Sorry, I forgot to start recording.
Hi.
So, right, and I think there is those drug testing kit type of things that you're talking about. I'm not extremely familiar with them, but I do think that like people who go to raves, they test their pills, right? I've heard of that before, where there'll be like an organization that's a harm reduction organization that sits out in front to say, yes, this is Molly, yes, this is MDMA or whatever you're after, right? Whatever you thought you bought. I don't know where you would buy those or where you would get those in essence, or if those are sold to the public in general. Do you know what I'm saying?
Yeah.
But I do think
you.
this.
So what we do have though are fentanyl test strips. So basically you would take whatever drug you're doing, if it's meth or I'm not sure how, I'm assuming it would be the same way with the Molly and ecstasy as well. But they do have to wet it down. It does have to be placed in water so that you can have something to test actually. And because powder forms can't be tested. Then you put the test strip in the substance. And again, like Kelly was saying, it wouldn't tell you how much or how little fentanyl is present in there, but it would tell you if there is a presence of fentanyl in the drug. The problem again with that is that if you are smoking meth and you want to know if there's fentanyl in it, you'd have to wet your meth down, either re-rock it, re-dry it, however it is to get it back to a smokable state. If you are an IV user, that's not a problem then because you would wet it down anyways. So as far as pills go, they would have to crush the pill down, wet it down somewhat. They don't have to submerge it in water, I don't believe, but they do have to wet it down somewhat and then test it with the test strip. So, I mean, we will provide these as well with the kits that you get. It's not perfect, but it's better than nothing at all for someone to be able to at least see if there's fentanyl in their drugs.
And my hope would, because as these weren't even out when I had my overdose, so they weren't even, it didn't even exist. So my hope is as everything, it gets better, right? So the hope is that these would get better to where they would actually be able to test the product itself in its natural form by rubbing it on there or doing some crushing it up. And you could, hopefully it'll be powdered, there'd be some way to test the powder because and even like with marijuana, you have to wet your marijuana down, test the water, and then you'd have to dry it back out, so there's a few users that probably wouldn't go this route. But for those who are taking pills, because you could ultimately drink whatever you crushed up and got wet to still get the effect. And for those shooting up for sure, can test the substance. And it's just another form of harm reduction. I don't think they're used as much as we would like to see. But we also have people who are fentanyl addicted and that's their drug of choice. So
That's
it comes with
really good to know. I didn't even know that was out there. So
Yes.
thank you so much.
Yeah, you can pick up whatever supply of these you need at the Steve Brunswick Home Network.
Well, so at the end, you guys will be able to check the boxes and you'll get these. And when you get them, if you can see, there's like a QR code on the front. So when you use this, when you are done, you could scan that QR code. It might want to get some information for their grants, like, oh, what was the population, you had given it out to, or whatever, or what did you use it for? What substance did you test if you were an addict, right? And so then they would just mail you out some more. So they make it really easy to get more. Yeah. Same thing with the Narcan kits or Naloxone kits. As they have a QR code on there too, so that you can always get another one or find an access point near you.
Yeah.
Do you, so, the folks here are kind of, they're based around shelters, right? Or housing. So do you give kits or like test strips just to shelters? Like, have you guys ever partnered in that way?
So I do a lot of boots on the ground. I literally work out of my car. And so
We go to the corners of the streets.
yeah,
and
I
hand
have
them out.
harm reduction kits. So I have whole kits packed with clean needles, water, cookers, ties, everything you could need to use, a meth pipe, crack pipe, everything. So you would have your own stuff. These, I carry around just a ton of these in my car and Narcan. So at any point, anywhere, at any time, someone could get these from me on the street in an organization. I'm always encouraging people to become Naloxone access points. So for one, you have an endless supply, right? Or for two, the people who are frequenting your organization also have access. So,
But we are an access point,
Mhm.
literally 2 blocks away from here, so if,
Oh, I
we're
didn't
at one
realize.
hundred West Water Street.
Yep.
Yeah,
yep,
Look at that.
yeah.
yep, yep.
And if you ever, and we'll go through the slides, but if you Google NAP and naloxone access point, it will populate a map
Yeah.
that shows you your closest access point. And you would be able to go into the access point, request kits, no questions asked.
Yeah,
Great.
yep.
That's great. Yeah.
Or if you have, like, so for your organization in particular, if, you want us to come do a training like this, so that the clients that live there are able to know how to use them and have them on them, we can
Oh.
definitely set that up there.
So you guys would go like into a
If you would like
shelter?
us to,
Like,
yeah.
Okay.
If
I
we get
mean,
permission
I don't
to,
know if. Yeah,
We're
there's
always,
lots of
oh,
logistics
yeah,
there.
yes, there's a
But-
back doors you gotta go through. But yeah, any way, anyhow, to educate, to inform, to give information, to give out options to keep yourself safe.
Mhm.
And I think the more we hand these out, the more we get people thinking about their own life, right? Even if they never use them, they're still thinking like, this is dangerous. These people are really handing me fentanyl test strips, right? And so if we can keep people thinking about how important they are, even to us as strangers, right? Then reminding themselves that there's hope, right? Because a lot of hope is lost with addiction and stuff. So reinstilling that hope. But yeah,
Yeah.
I don't know, like, if Opportunity Center or Dorothy Day Browns has a bunch of these sitting around. I don't know if that's the case. But I think you guys having a relationship, with Steve Rumler, reaching out to Maddie, like, hey, we work with so many clients, so many of them are using some of these fentanyl test strips. Is there any way I could come by and get 40 of each? You could always do that with them. They'd rather see these in the hands of people who need them than sitting on the shelf in there. Not that they ever sit very long. They
Yeah.
definitely are always doing kit packing events. So yeah, you can always request kits if you're gonna do an outreach thing, like, hey, we're going outside. We would like to see if we could grab some kits from you. Would you mind? Maddie's super willing to
Great.
make that happen.
And just so
Yeah.
you folks know, like, if you want me to help connect you to Maddie, I can do that too. Folks online.
And now that you guys will go through like now you're doing the training. So then it's really easy to become a community trainer. Then you just go to the once a month on Tuesday, I think it's at noon, it's train the trainer orientation. And then you could be a trainer for your community and go out and do these trainings in your community. So it's really nice to be able to do this as well in your organization, in your community. Or we could come, doesn't matter.
Lots of options.
Yeah, for sure. Accessibility is the key word today.
Mhm. Should we go to the next
Sure.
slide? All right.
So the evolution of the crisis, and if you ever want to watch a good show about kind of the prescription drugs, it's called Dope Sick on Hulu.
I've seen that. It is
Yeah.
so good.
Really depicts what the pharmaceutical companies were doing. The less than 1% of chance people getting addicted. They're really selling it out, and they're really hitting a lot of those rural areas that might not know better. And then the overprescribing, and so a lot of that was in the 1990s, and then in 2010, heroin, got popular. A lot of people got barred from, getting it, or people got hip to the addiction being kind of coming about from it. And I think your addiction came out of an opioid.
I was overprescribed pain medications for about 5 years, and it very quickly went from a need to a want.
Mhm.
Terrifying situation, and then, which resulted in a whole lot more down the line. But super happy to have experienced that, to be able to do what I do today. But the point is my entire story is wrapped around kind of that over prescribing of pain medication. And so I'm definite testimony to that. And then, eventually got to be to where my doctors told me no, right? And so then I did not ever go to heroin, but most of the people that were in my situation did then switch to heroin. It was cheaper, easier to access. And then, in the more recent years, we've got our synthetic opioids. So we've got the fentanyl. And then even the more scarier ones today, I can't remember the name of the newest one is.
Well, it's not an opioid, but the carfentanil would be a sister of the fentanyl, which is stronger than the fentanyl. You're thinking along the xylazine,
Yeah.
but that's kind of a whole new wave of problems, right? Because
Yeah.
it's not opioid. and they say it's in the suburbs and it's gray death and all this stuff and it's Narcan resistant. Xylazine being xylazine is Narcan resistant, just like a barbiturate would be, or just like alcohol would be. Narcan is not going to respond to those substances or products or whatever pill or whatever medications. But what it does do, because we talked about, you're going to likely have opioids in your system, it's going to allow you to get those out of your system. So that takes that stress off your body, the overdose potential, and you're not going to, might have a heart attack,
You
stroke from the
lengthen-
xylazine. Yeah.
Yeah.
But
And-
chances are you'll be able to regain your breathing
Yes,
ability.
yes,
And that-
yes,
That's what the
yeah.
opioids do.
Yeah.
Is they stop you from breathing.
Yeah.
So, yeah, this is kind of the evolution of the crisis and why we are where we're at today, why it's the number one accidental or death in America, so.
Well, and I've been an addict since I was 12 off and on, and I got here in Minnesota in 2002 and struggled and would get into recovery for 18 months to 2 years and then go back. And so it wasn't until about here, and I was just snorting heroin when I overdosed. People say, well, just don't shoot up, snort. No, just don't do any drugs right about now is really where it's at. But I saw this whole wave happen. I'd never heard of fentanyl before. I mean, I heard of it, but I never saw it on the street. I mean, it's for people who have hit the last kind of thing with pain.
Yeah.
And it's suckers and it's the patches and it's being watched by a doctor and it's pretty serious stuff. And so to see it in the streets like it is, it's really, really scary. There's a kid that I was working, I was high school I was working at, the lady who runs a summer school program came up to me and said one of the students had admitted to her that he, as a high school student, was using fentanyl. And so it's even touching some of our high school kids.
Yeah, for sure.
For sure.
Mhm.
And so this is just in a graph form. We kind of talked about those waves, right? And so that fourth wave is kind of the COVID and the fentanyl. And I think if we are on to a whole new wave with xylazine, and the scary part with that is horse tranquilizer. So it's not even meant for us, period. And it's also flesh eating. So you ever hear that crocodile?
Yes.
So it's in essence somewhat like that. And so you see a lot of people who are using drugs today. They have a lot of open sores and things like that because the xylazine is getting into a lot of the drugs too.
Yeah, I just saw an article about the flesh eating.
Yeah.
Yeah.
I'm scared.
And you're addicted and it's hard to stop. And so you just keep killing yourself and it's terrible. It makes me very frustrated at the drug dealers or drug people in Mexico or wherever it's initiating out of, because it just doesn't seem like it's necessary. Because it's very sad. So kind of our Minnesota statistics. So synthetic opioids continue to drive a rising overdose rates in Minnesota. So there were 977 opioid involved overdose deaths in 2021, which is a 44% increase from 2020. And 9 out of 10 of those were synthetic. So that's just how often and how frequent people are getting a synthetic opioid in their drugs. Greater Minnesota saw a larger percentage increase in fatal overdoses in the metro area. I did a lot of outreach with the North Memorial Community Paramedics doing community trainings and had a paramedic who did a lot of did about the first 15 years of being a paramedic out on the reservations. And it was just like another day at work to be reviving someone. I mean, she said we could do as many as 8 a day. So, yeah. Very sad. And so fentanyl right there is in the middle, and then carfentanil is kind of the sister and very, 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 very strong. And so if someone thinks they're getting heroin, ends up with one of these two others, they're 90 to 99% of the time going to go into an overdose for sure. It's used to lace the counterfeit pills, cocaine, meth, heroin, and more. And fatal overdose can be as small as 2 milligrams. And so fentanyl is 50 times stronger than heroin, but it's cheaper to produce and it's more potent. And so, and there's a good video on Steve Rumler, and also there's an instruction card in the kit, but they do a whole little mock-up of how to test substance. And I think it's rumlerhope.org/FTS or something fentanyl test strips, but though there's a whole video on how to use these. Yeah. And so statistics on racial inequity. So of course, we know that it's even drugs in general haven't impacted all communities equally. And it doesn't change with the opioid crisis we're in. So Minnesota has one of the worst disparities in drug overdose mortality in the country. Definitely impacted communities of color, our African American, and then our Indigenous community, the biggest. And so Black Minnesotans face 3 times the risk of drug overdose deaths than white Minnesotans, and our Indigenous Minnesotans face 10 times the risk of overdose deaths than white Minnesotans. Rates of substance use are similar across demographics, but health inequities increase risk of fatal overdoses. So a lot of it's got to do with barriers to healthcare, right? Lack of people who look like you responding to you, right? Some of that historical trauma seeping through. We got risk factors, right? So there's trauma, financial hardship, stigma, and then distrust of emergency service persons. You know, I've heard before a while back where people were getting tickets for ingestion or paraphernalia type thing or using type of thing, which just seems you have someone who's dying and that's the last thing that they're worried about or you need to be worried about. It doesn't make sense to me. You thinking it's a deterrent, but it's not. It's just another barrier and another way of showing people that we don't care and we want to make things harder. I do think it's getting much better. I think the world is changing and it shows with these community organizations reaching out for more training and more information, right? And so then the people who work there are getting that information and they're taking it to the street and they're doing it in their work. So I love when I go out on a community training because I just know that's just another group of people who are more like-minded and helping versus trying to deter or shame or stigmatize people. So I think the world is getting better, but of course we have a long way to go still, I think. So on the Making the Impact in 2021, there were 5,964 emergency room visits for opioid involved overdoses compared to 978 fatalities. So people went to the ER. So the other piece of this is these opioids, I had talked about the 9 doses, right? So people are being Narcaned up to 9 times and maybe even more, but the chances are that people can go on Narcan drips at the hospital because of the amount of opioids and them not being able to stay with us, once getting the Narcan. So people going to the hospital is super, super important because what could have that strain been on your heart or your brain or your cognition or anything like that, or your breathing and stuff. So really making sure people go or encourage people to go, making sure we're the ones that call for the ambulance just to give them the option. Or maybe it's like, I'll ride with you, to get you there, because that can be really scary. I know from my own experience coming out of my overdose, I was in the hospital, but I couldn't tell you, even if you said you'd give me $1 million, I was at the hospital. And I felt shame and I cried for like an hour because I'm the kind of person who needs to know everything all the time. And so I had to work the courage up to ask about where I was at, but it took me over an hour and I was disorientated enough to not know I was even in the hospital. So but many people are going and they're getting the help and that's helping us from having to lose people. Yeah.
And we're glad you're here.
Thank you. Thank you.
Yeah.
And so kind of talk about reversing an opioid overdose and identifying it. And these kits are this color because they're UV resistant. So just helping the stability of the medication. And every 365 days of the year have them in my car. So it's good. I just would encourage you not to leave them in the dash or, where they're going to get extremely hot. So we're going to recognize the signs of an opioid overdose, what naloxone is, how naloxone works to reverse an opioid overdose, and how to give a person naloxone who has overdosed. So this is an opioid overdose. So when someone takes too many opioids, breathing starts to slow down. It becomes more slower and more shallow. They become very sleepy and unconscious. Those low oxygen levels begin to cause damage to the heart and the brain. And untreated breathing stops entirely, and eventually the heart stops. And what that looks like is a 6-minute window. So that's what we're working with on time. And so we don't know when we come into that 6 minutes. So, doing the best you can in the moment. And even if you feel like you're too shaky, if you've got people around you that might know how to use the medication, be like, I've got a kid, I'm a little bit nervous. Or does anybody want to step in? Can you call 911? You know what I'm saying? You can, if there's people around you that you trust to help you through the process, then definitely can lean into them. Then go to the next one. And so this is going to show you what rescue breaths can help, right? Get that person the oxygen they need. Naloxone alone. I know we don't know people's medical history, and we're just getting out of COVID and lots of, stuff that goes around the world here with colds and stuff. But naloxone alone will can help save somebody's life. And what the two do together. Go to the next one. And so this will be a lot of repeat here, but it's signs and symptoms: unconscious, unresponsive, difficult to wake, slow and shallow breathing, small pinpoint pupils, unresponsive delay. We all got flashlights on our phones if we needed to use them. Struggling to breathe, making gasping and gurgling signs. Oh, yes, go ahead, Joan.
So, can the dose that is given out be used for anyone from infants through adult? And I guess that's my main question. We had a horrible incident in shelter a couple weeks ago, and I had an infant that we did CPR on until the ambulance came, and they did the Narcan, and he came around, but I didn't know what dose or if we should do it or not do it. And
So I
people are
probably
nervous about
want
that.
to. Yeah, no, I think, yes, that would be correct. I would be myself a little bit hesitant using the IM needle with a baby. So I guess if I have children, or if I know I'm working with people who have children, I would probably say, go get you some nasal Narcan, because I would feel better. I would hate to damage the baby because of how little they are and how much is muscle, how much is where's I would feel really weird about that. And you could always do a half a dose too in the beginning to make sure, but you can't hurt anybody with Narcan. The only side effect is less than 0.01% people have an allergic reaction. That's the only known side effect. So you can't hurt anybody. You couldn't hurt me if you gave me a shot of naloxone sitting here right now. You can't hurt people if they're sleeping on another substance, or even if it's expired. So I guess for me and my own comfortability, because it's a baby or a small child, I would probably, whether it's $97 or $150 and I might need it, I would probably buy it for my own comfortability of administering. That would just be me. I think you could use an IM kit, but just being gaugeful on how much of the needle we're using, right?
So the needle has to go into the arm, the butt, or the thigh.
And it needs to get to the muscle.
It needs to get into the muscle. So our only concern is not about the naloxone or Narcan itself. It's completely about the needle itself.
And so I'm going to show you, this needle's very large and a little intimidating. And I don't know if you can see that. So it's a pretty big needle. So that's the only, is it in the thing? Okay, there we go. So that's the only thing, a little bit my way. Maybe not. Up a little.
So.
Oh yeah, there you
that
go.
is-
Now you can see it.
So that's where our concern is. But
Yeah.
can you cause damage to any individual, even
No.
if they don't need it?
No.
No. It's an absolutely safe, the drug itself is absolutely safe for anyone to be administered with it.
And it's 0.4
anybody.
milligrams. So you could always just use a half. You could use it all in essence if you needed to. I think we would be fine with that. I guess, and again, I would go back to what I would be comfortable with, and I would probably be more comfortable with the nasal with a kid, just not to hurt them. And be nervous in that moment because it's a child. I might feel like I would do something stupid with the needle. But yeah, it's perfectly fine, and I'm so glad the baby is okay. That's so good, but what a scary situation. I'm sorry you had to go through that. Did that kind of answer or give you
Yeah.
a little?
Yeah, thank you. I might see if we can get some of the nasal in shelter. Where do you get that through, and how do you get the nasal? Is it prescription?
So if you have families that have children, they're in shelter, they're most likely on state insurance. You
Yeah.
could take them to the pharmacy and they could get that on their state insurance for probably their copay, which is the cheapest route to go. But if you wanted to, you could get a hold of Steve Rumler. So we bought 12 doses, 12 nasals, and it cost us $500. It's so Steve Rumler sold that to us at $47 a piece. So, and that's what they get it for, right? So, but what it cost is like $97. So it's crazy expensive. But if you have families that are on state insurance, I would say let's make a trip to the pharmacy because all it takes is someone dropping a pill or leaving a baggie around, or it could just be something so just not even but accidental that these kids can run across this stuff. But yes, I would do that.
If I can't get someone to come in and get that, I think our staff would feel much better if they had that nasal option for a child. And since we did run into it, I think it would bring it on home that, even if it's a child or an infant, we can do something about it. So I would really like to get something on site because that was horrible and scary. And it traumatized the staff. Having to do CPR, it traumatized the staff in general, just calling 911 and because it was an infant. So I think even if I had to pay $97 for it, would I
Me
just
too.
go to the local Walgreens or where
So
how do you do
let's
that?
not pay 97. Let's get a hold of Steve Rumler and you can buy it at their cost for 47. The other thing is because I was trying to get it into the schools. So schools are allowed through this opioid grant. There's lots of grants and lots of money. And that's why you guys reaching out or another organization reaching out should be able to access this. I'll get Twyla's email and I will dig through my emails about that and what that looks like. Shelters there. I know schools were on it. I don't remember if shelters were on it, but I'll find that email and I'll forward that to you because you might be allowed so many doses through all this money that's had to be paid back to the states from what the opioids have done to maybe access a few of those free, right? And where we can get it free is always a good thing. So we might need to spend money other places. But yes, and then getting a hold of Maddie and ordering it from them would be your cheapest route if you couldn't get a family or a parent to go in to the pharmacy.
Also, if any of your staff themselves is on medical assistance,
Insurance.
they can go in and pick it up too, $3 copay or whatever it is.
And then I wonder what is maybe some private insurance, what are they covering now these days? I don't have private, I have state insurance.
I actually.
So I don't really know what that looks like, but that might even be a phone call to your insurance and asking them, do you cover Naloxone? Is that something that I could receive a prescription for to have on hand? I have a job or, something like that. But yeah, thank you for asking. And yeah, that was a great just conversation there. And I
Just
would have been extremely scared.
to clarify, the difference between Narcan and Naloxone is not.
A name. It's a generic versus a name brand.
That's if that confused, because I know at first that confused me. I was like, what? So
Say medication, Narcan's the nasal,
Narcan's the nasal. so, yeah.
Naloxone's the IM in essence. Yeah.
So in the follow-up email, I'll include all of that information.
Perfect. Yeah.
So we'll chat and
Mhm.
then, yeah,
Definitely.
okay. So we have just 10 minutes
Sure.
left. We just want to do time check.
So naloxone is a medication that's been used for decades. We just have never had to see it in its kind of clarity here. But it acts as in the brain to immediately block the effects of the opiates the person's taken. It can last up to 30 or 90 minutes. But that doesn't mean that one dose is going to solve all your problems. People can have enough opioids that one dose isn't going to do the trick. And we would administer another dose. There could be another dose and another dose. Mhm.
As many as you need to.
Yeah.
As you have available.
And so this is kind of what it is. That orange is the opioid, the naloxone's the green. It has a stronger bonding agent. And it can knock the opioid off the receptor bond. And it allows that person to breathe again. So what it does is that it takes that opioid immediately out of the system. And it reverses the overdose. These are the medications or substances that can be reversed. So even people on methadone or buprenorphine, they take too much of it, they could overdose. You could save their life with naloxone. Any of your codeines, your fentanyl, your carfentanil, and your morphine and your heroin. And so what it can't is your stimulants and your alcohol and benzos and the xylazine, right? I was a dual user. Lots of people are smoking meth and doing heroin or doing fentanyl and meth or smoking weed and popping perks, or there's nobody who's just really a one track user. And with today's drugs, you're not really a one track user, even if you were.
If you wanted to be.
So if we can get the opioid out of the system, we can reverse the possible
what we're
deadly
saying is-
effects.
If there is even a slight chance, when in doubt, just Narcan, just give them the naloxone.
You're not gonna
Just, you're not gonna hurt them either way.
And you're working out of the Good Samaritan kind of perspective. And so if you weren't able to revive somebody, just like CPR, you can't be sued.
Yeah.
No family member can come after you for not saving their family member's life. You attempted on good faith to do whatever you could. And so there's the civil protection through the Good Samaritan.
Okay.
And so like we talked the side effects, less than 0.01 chance there might be an allergic reaction, but we're getting the EMTs there. Excuse me, the EMTs there and they can respond to that. Talked about that, how it doesn't cause harm. The only side effect is the one we just spoke about. So there's these different methods. So we talked about the nasal, the one with that yellow cap on it, that's the IM. The one below that is, you could ultimately make these IM kits into nasal and you would just buy nasal atomizer. So that needle screws off the top. You could buy a nasal atomizer, even on like Amazon. And you can make this an IM. That's another step in the process in the midst of doing it. And those two bottom ones aren't even on market. And the other method is intravenous, but we kind of talked about that already. And so where you can get naloxone. So we as Minnesotans can carry it. Pharmacies are third-party prescribers. There's naloxone access points, and any community organization can partner with Steve Romo to become an access point. So we talked about the naloxone and the access. And so the other thing is the immunity, and you can go to the next slide. So the immunity looks like the protection under the Good Samaritan law, encouraging people to help with the civil immunity, the criminal immunity, which is really nice. So people are on parole, people are on probation, people don't want to get caught up in a police call, right? But if you're in this, participating in this, saving a life, helping render aid, helping making a call, you can't be restructured or revoked.
Okay.
Because you got caught up in the middle of that trying to stop and help. This encourages people to stop and help. And also you can have up to 22 pounds of weed on you, 10 of your other substances and 3 of your primary, and you can't be criminally charged.
Wow.
Yeah. Right now it works like me and Danielle are using together. We probably likely got the substance from the same dealer. She's going to overdose. I'm going to render aid. What about me? So if everybody else runs, I might overdose. She's not gonna be in any shape to save my life. And we might not have gotten 911 call by that time either too. But right now it only protects two people, the person rendering and the person receiving. They're trying to build legislation out or build it out or go to legislation where it'll protect a group of people so people don't run. People stay and help each other. So it hasn't gotten that far yet, but that's the next step they're trying to push for.
Great.
Mhm.
But in essence, anything Kelly's got on her, if she's saving my life, she's not gonna be criminally charged with.
So you can go to the next one. So we're just gonna kind of talk about the IM administration. I'm gonna skip these because we talked about the signs and symptoms. Again, there's instruction cards in each of your kits. So we look for the signs, we attempt to wake that person up, we call 911. This is very important about the calling 911. Do not say it's a drug overdose, say it's a medical emergency and someone is unresponsive. The bias of the person, even if they're sitting in dispatch, we have no idea. We don't want to delay help. So we're being very honest, they're non-responsive, and it's a medical emergency, and leave the rest of that out. Let's get the EMTs there and then,
I can tell you that the research was done at North Memorial and the facts came out that they were much less, they weren't very quick when they knew it was a drug overdose. So just tell them someone's unresponsive and get the help there. And when they get there.
people become, people get frustrated. If they're getting 95% of their calls are drug doses, they're gonna start to get pissed off, just sorry, being frank.
Yeah.
And that shouldn't be the case because that's your job, you're dispatching. I don't care if it's a prank call, it's still a dispatch that you have to do, but it's the truth. And maybe they lost a family member, maybe they hate drugs, maybe, who knows? And so just to try to stop that from being
An issue.
an issue in the situation you're in is a medical emergency and they're unresponsive. Truth. This is what's in your kit. You got a pair of gloves, 3 syringes, 3 vials, 3 alcohol swabs, a breathing barrier, an instruction card. You can go to the next slide, in 4 different languages. So it makes it really easy to read for people.
Great.
You can go to the next one. And so what you want to do is you want to take out your gloves. If you decide to do the breathing, you put the breathing barrier over the person's mouth. You tilt the chin. We're looking to open that airway. We do a couple test breaths. We're looking for the chest to rise and not the stomach. That's a case, just reposition. We only want to use the air that's in our mouth. We don't have to take any huge deep breath. We want to use the air in our mouth. We don't want to tire ourselves out either if we're going to do rescue breaths. And we kind of talked about that. Make your choice. Naloxone alone will still have a positive impact. And so you're going to take the syringe out, get the cap off. You see how that needle's twisting off right there? Well, it should go back, but that's how you would put the atomizer on. You can just untwist it and then you can make it atomizer. And so you want to put some air in the syringe because that vial is vacuum sealed. They kind of show you can tip the vial on top. You want all that medication. That's 1 dose. You're looking for the buttocks, the thigh, and the upper arm. And this is what it would look like, an upper arm or, a thigh.
You stick that needle in
Yes.
real far.
Yes. And if you can't get to bare skin, right? We want to get to bare skin, especially when our homeless population, they might wear their clothes for a long time, might not have showered. We don't want to expose them to other risks. But if you can't, go through their jeans, go through their sweatshirt, go through a thin layer of clothing, that is absolutely fine. Yeah. And then recapping, right? We want to be careful. We don't know people's medical history. So we like to go in with 2 hands as human beings, but scoop up that needle or that cap and then put the needle cap on. We also can leave it right next to us and let the EMTs know it's right there and they can dispose of it as well. So what we're doing is we've attempted to wake that person up. We've called 911. We have taken out our kit. We've prepped that person. We've given them naloxone, and now we've done 1 breath. Now we do 1 breath every 5 seconds for 2 minutes while we wait for that naloxone to work. If they don't come to, we do naloxone again, and then we can do 1 breath every 5 seconds for 2 minutes, and it's just a repeat. And then I'll go through the nasal kind of, you can go on that and you can go. And so it's all the same steps. You might have a few more steps because the foil has to be taken out. You got to take it out the box or whatever. And the only difference is we're administering in the nose. It absorbs through the membranes in the nose. So a lot of people are like, well, if they're not breathing, how are they going to get it? So it absorbs in their membranes. And if you go in one nostril, try to go on the next and the other nostril next, just for better absorption. You go on probably a couple more slides. It just kind of tells you how to use that. Same protocol, 1 breath every 5 seconds for 2 minutes while we wait for the naloxone to work. If not, we re-administer. We want to put that person in a recovery position, thinking about trying to breathe after you just came back from death and you're on your back. It isn't very comfortable. Also, what if that person vomits? We don't want them to, I can't think of the word, but anyway, choke on their vomit. And then it's just probably much more comfortable to be on your side. Also, you could put that person back into the position you need to if they were to slip back into an overdose again. We do not want to leave that person. We could give them space because I talked about my reaction, right, to overdosing. It was super emotional. People can get, oh, fucking, I'm not high anymore. Or, they can, I've never heard anybody get up and fight anybody or anything like that. They could get up and walk away, right? So we just want to stay with that person until the EMT comes, even if it's just at a safe distance. But allowing them to see that you're still there, but also providing them with the space they need to deal with the situation they're just coming out of. And we just talked about the emotional.
Because they will be an immediate withdrawal.
Yes.
Yes.
And I think even I saw in the news, ambulances are starting to carry Suboxone on them. So when they do the naloxone, instead of, they can offer the Suboxone to help with those withdrawal symptoms. So maybe that encourages people not to have to go and use right away again, because you could overdose again, And again, you guys are taking a risk, in the situation, maybe in a sketchy situation or sketchy area or whatever, right? And it just seems safety, I guess, is my biggest thing. Keep yourself safe. You're important in this whole grand scheme of things. And so just remember that you're important and keep yourself safe. And then safe disposal. I know you guys know anything not that's puncture resistant, leaving it for the first responder. There's always receptacles all over the place, bathrooms and stuff like that to dispose of them. So try to keep it room temperature. But like I said, and I'm sure a lot of us ride around with our naloxone all the time. It's perfectly fine in your car. There's a 2 to 3 year expiration date. That lasts much longer than that. But you never have to carry an expired kit. You can always take an expired kit to any access point to get a current. And you'll find the expiration date right there next to the lot number. This is what you would Google naloxone access point. It looks exactly like it does right there on the screen, how it would show up in your on your phone or on your computer, and it will tell you your nearest site. And it should have like the NAP right in the window. So those are the fentanyl test strips, and then it's rumlerhope.org/FTS, and they will literally walk you through testing substance. If you ever wanted to support them in other ways, you could do a kit packing event with your organization members. You could donate, you could be a part of their gala, you could donate something to the gala that they could auction off. Lots of ways to support the folks doing the work. And so in summary, naloxone is super important to our community. There's criminal and civil immunities. Naloxone can be carried and used without a prescription. You can get naloxone at any access point or from CVRM with no cost, the IM kits. Nasal Narcan, of course, can be purchased from pharmacies and often covered under state insurance, and that you can revisit the instructions and videos detailing the administration of naloxone on Steve Rumler Hope Network website. So you'll scan the QR code. They'll ask for who your trainer was. You just do other, and it's just put Kelly. And then they just ask you for some demographic information. And then for those on Zoom, just check the box for a free IM naloxone kit.
And I'll put these instructions in the follow-up email too. Yeah, wrap it up.
Yeah.
Is
Was
that
there
it?
any questions
That's
at
the
all?
last one.
Yeah.
Okay. Any quick questions before we turn it over to the next part of the session?
I thank you guys for
Thanks, you
joining
guys.
us. I really do and
Thank you
appreciate
so
it.
much.
Yeah.
This was great.
Good.
Thank you.
Yeah.
Great. Yes.
Yeah.